Hi everyone, my name is Jenita Tarigan with class student number 2063. Here, I will debate as a government as well as opposition team with the motion euthanasia should be legalized in Indonesia. Alright, as a government team, I'm going to start my speech at 3, 2, 1. Euthanasia is an action aimed at eliminating someone's suffering by ending their life. There are five types of euthanasia. First, voluntary euthanasia. Sufferers with their common sense agree to lethal injection. Before carrying out the procedure, he is fully aware of the disease condition and understands the risks associated with the treatment options. Second, non-voluntary euthanasia. This decision to be lethal injection was based on the agreement of the closest family. The sufferer undergoes non-voluntary euthanasia because he is truly unconscious or permanently paralyzed. This procedure can also be carried out at the request of the sufferer when he was still conscious, for example. Third, involuntary euthanasia. This lethal injection procedure is a condition when the sufferer can make a decision but does not want to do it. In other words, he still wants to live and fight against his illness. Fourth, active euthanasia. An active euthanasia procedure is a situation when the medical team acts directly to end the patient's life, for example, by giving high doses of medication. Fifth, passive euthanasia. This procedure is carried out when the medical team indirectly ends the sufferer's life. This is done by stopping or limiting the treatment needed to survive. In addition, passive euthanasia can occur due to increasing the dose of prescribed drugs. There are several countries that support euthanasia, such as Netherlands, Oregon, Belgium, Switzerland, and Washington, D.C. These countries argue that a civilized society should allow people to die with dignity and without pain. Patients have the right to be helped to end their lives if there is no longer any hope of survival. The body is the owner's own prerogative, so a person can do what they want with their own body. Countries that allow euthanasia or lethal injection assume that medical personnel and family should not seek longer life if the patient no longer wants it. In fact, it is considered a violation of personal freedom and human rights to force someone to continue living in suffering and pain due to illness. Countries that legalize euthanasia state that assisted suicide is not a criminal offense, so it cannot be classified as a crime. This government agree with them because we believe that everyone has the right to their own life and body. For example, a cancer sufferer, Miss Brittany Maynard, who had a terminal brain cancer and committed herself, believed that choosing to die was her right. She believed that she deserved this option and that no one had the authority to refuse her access to it. She felt that this option was far more human than suffering in excruciating bodily and emotional torment for weeks or months. Because there is no chance of recovery and no potential of responsibility to serve others in event of euthanasia. One could argue that protecting the right to die is egoistic and selfish. This is untrue. The patient is also selecting the benefit of others in addition to his own. The sufferer does not wish to burden society or their loved ones. Euthanasia proponents contend that as it is an act of justice and compassion towards other people, society should recognize and allow a sufferer's right to choose death. Proponents also assert that denying a patient the option to choose death is equivalent and to refusing to accept death. Alright, as the opposition team, I'm going to start my speech at 3, 2, 1. The value and dignity of a human being transcends the simple experience of pleasure and pain, according to those who oppose euthanasia. Therefore, it is always unethical to end one's own life in order to avoid pain. The mere act of avoiding harm cannot replace the value and dignity that each individual possesses. To one, suicide or self destruction is an indication of a lack of understanding of one's own intrinsic worth and dignity. Provenance of the idea that life has inherent worth contend that nature determines when a person dies at dawn. One of the existential issues facing humanity is suffering. Attempts to legalize euthanasia, the practice of murdering patients in order to eliminate their suffering, damage our moral integrity because they represent a false understanding of both suffering and ourselves. We as humans are inevitably going to experience suffering. It is among the unavoidable experiences that most people have in life, along with aging and death. Everyone has obligation to protect their own life as well as the lives of their neighbors. It is not seen as an unavoidable obligation to preserve life in the appearance of pain and misery. Rejecting life-prolonging treatment that is both extremely burdensome and unbeneficial to the patient is morally permissible. As previously stated, non-obligatory treatments are elective, whereas mandatory treatments must be used. Doctors have a duty to administer medications to patients who are in excruciating pain, even if doing so could shorten their lives, but is not intended to cause death. The goal is to relieve the patients of agony as much as possible so they can pass away peacefully and honorably. Therefore, even while this type of therapy provides consolation to the patient, it may also have the unfavorable impact of reducing the patient's life duration. Instead, drugs with the ability to release pain should be administered to the dying individual. It is crucial to emphasize that in these situations, the goal is not accidental death, but rather a reduction of suffering. Additionally, this opposing team disagrees that patients should be a financial burden on their families. Every life is valuable and of the highest caliber. Regarding love quality, the norm is that no one is qualified to declare that a patient's life is not valuable due to a low quality in life. It is unethical for a doctor to assess a patient's quality of life. They have no right to do so since nobody is qualified to make such a determination. A patient's quality of life cannot be evaluated by a doctor or anybody else because it is essentially subjective and depends on the patient's personal experiences and belief about what makes life meaningful. While it makes sense that individuals in excruciating pain would request euthanasia, most of those patients or brothers and sisters do not seek the solution. They yearn for company, affection, and understanding. The demand that comes from the human beings in the highest conflict with death and misery, particularly when suffered with the desire of giving up, is absolute despair, is above all an appeal for love and companionship, sympathy and support in the time of trial. Evangelium Vitae explains clearly. Furthermore, if assisted suicide is permitted, the elderly and impoverished will be particularly vulnerable to abuse. It is essential to oppose euthanasia in order to safeguard these defenseless individuals. When society fails to provide adequate health care, these people will face pressure to request euthanasia. Since euthanasia involves taking a patient's life, it is unethical. No matter the motivation, killing is never acceptable in the eyes of a sane human person. It is wrong to commit suicide on your own, to ask someone else to do so, or to assist someone else in taking their own life. This opposition team will definitely win this debate. This is because euthanasia from a human rights perspective is a violation because it involves the patient's right to live, which must be protected. The Pope once said, Loving the sufferer rather than eliminating her is a choice we must make together as a community of persons. Thank you.